Good evening. Dave Michael Sminky again. Thanks again for tuning in and watching us and keeping us in your prayers and just following along and I guess enjoying the journey with us as best we can. Um, so in the way of update, so last 2 weeks, so I think last time we were talking about what kind of chemotherapy options we were going to have, and we are going to go see a neuro-oncologist. So that ended up happening. We went and we saw a neuro-oncologist, or at least an oncologist in Memphis, Tennessee, to basically confirm my thoughts that I had in the last video, basically between PCV chemotherapy or TMZ chemotherapy plus radiation. And there's a slight tendency towards favoring PCV with potentially down the road maybe some clinical trials that involve some of the specific mutations that Britta had. So we met with him in Memphis, and then let me see too. Oh, her follow-up CT scan was also unremarkable too. So thank you for praying for that as well. So did those things, and then traveled back up to Michigan where we live, made it home successfully in one day. Our kid gave us no trouble. It was like 11 and a half hours of peace, and the last half hour of it he was a little upset, but I'll take it. After that, we went and set up appointments to kind of reestablish care back up here in Michigan. We're working at the University of Michigan. It's very nice. They've got everything kind of in a row in terms of what we need, all the positions. You've got radiation oncology. We met with their neuro-oncologist. We met with a fertility person there, and also met with their neurosurgery kind of representative from one of the neurosurgeons there as well. I think it was, I didn't really realize how much I needed it, but during the second neurosurgery kind of appointment when the neurosurgeon said, hey, I don't think any further surgery is warranted. Like, I feel like there was a relief there that I didn't know that I felt like I needed. I feel like it was just kind of nice to close the chapter on neurosurgery, for better or for worse, and just say, hey, you got two very good neurosurgeons saying, hey, don't do this. And then a friend of ours actually connected us with somebody at Duke University who was kind enough to review British scans as well, and they felt that no further surgery was warranted either. So I guess when you've got three neurosurgery groups kind of saying, hey, don't do more neurosurgery, feels very reasonable not to do more neurosurgery. In terms of going forward, Britta gets another scan on Friday, which is the 11th of this week. That will be two kind of special scans. One is an MRI, one is a CT, but essentially just helping to prepare and at least do the pre-planning stages to do radiotherapy. So what they do is they scan your head, and then they kind of plan to do a 1 centimeter margin along where they resected previously, and kind of just irradiate that tissue in the hopes of kind of making it or just have more mutated so it dies, and then hit it with chemotherapy afterwards. I think we had another debate with, not debate, but just discussion with her oncologist here, again between PCV and TMZ, and the debate kind of between which is superior kind of rages on still. There is a clinical trial that's actually comparing both of them. Unfortunate with clinical trials like this, they don't tend to release data because they don't want to kind of steer somebody one way or another, and that's an unfortunately appropriate thing to do. But it means that we are still kind of stuck between, well, what do we pick? And I think I'm leaning more towards doing radiotherapy and PCV, because I feel like I've got evidence for this that's been working. It's multiple agents. I guess that's worth something, as opposed to TMZ, which is relatively newer, better tolerated. TMZ's infertility risk is about in the 50th percent risk category, or between 20 and 70%, whereas PCV's risk category of infertility is about 70%, unfortunately. So it's one of those would you rather games that you would never really want to play, but here we are. So I think I'll take the devil I know over the one I don't. I think we'll probably end up going with radiotherapy followed by PCV chemotherapy. With TMZ, you can kind of do it at the same time, so you do radiotherapy and TMZ. But I think, like I said, I think we'll probably end up going with RT, radiotherapy, and PCV. So in terms of fertility questions, turns out you really can't do, I guess in this situation, you can't do radiation therapy along with like egg harvesting, for example. So we're actually doing an accelerated kind of pace to go ahead and get Britta to have a cycle and to then harvest from that. again, a word that I thought I'd never have to use with my wife is harvesting my wife, followed by stabbing my wife with injections. But it is what it is. And I think I'm grateful to live in a position where we can do these things, and I mean, it is still what it is. I mean, it's still, you try and find silver linings you didn't really necessarily want to find, but you find them. Other things, people could ask me like, hey, what's a pathology? Well, I still don't know the complete path. There's a couple different reasons for that. Usually when you take pathology, you get like a preliminary read, which I think we got a reasonable enough answer down in Memphis. It's consistent with an oligodendroglioma, again, which is the same tumor Britta had previously. The question is kind of grading and then molecular pathology on it. So grading is where someone takes it, looks at a microscope and says, it's about this much bad. And they do a much better detailed job than that, but that's essentially what's happening. And then the molecular pathology is a little more objective in that they find certain biomarkers or mutations that your tumor has, and say, well, these are the mutations, this is what it is, and here's kind of what we know works on these mutations. So broadly speaking, it's kind of a move from this concept in medicine called evidence-based medicine, where we know that things work well for this group of patients. We know we have to treat 10 people to get 2 or 3 people better or something like that. Whereas precision-based medicine is more like, well, who are those 2 to 3 people out of that 10 that we should have treated to do that? So those other 7 people don't need to do it. So broadly speaking, I think we're in this interesting transition period in medicine where we're finding all this information out, and really specific information out about our patients in pathology. So interesting to be in medicine right now. And I think big picture planning, where's Britta at? I think the most optimistic data would probably put her at like an 80% chance of making it 15 years, which is a study the neurooncologist here revealed to me that I hadn't read yet. So I was appreciative of kind of being, your oncologist is good when they can one up you on some things, I guess, kindly one up you. And then I think the more pessimistic data would put something like maybe 2 to 3 years for Britta potentially. So I think Britta's got all the right, at least initial markers from her 2016 pathology to suggest that she's going to do very well. But tumors can change, and Britta essentially has 3 tumors right now. Again, that front one, that middle one, and then the side one. So side one basically resected, front and middle one still present. So I think what also sort of a delay in the pathology is they have to review all 3 of those kind of separately and almost treat them differently. So as soon as they have the information, certainly we'll share that. Ways you can pray. I mean, pray that, I went back to work, so you can pray that that goes well. It has been. It was good, relieved to think about other patients besides, I know that is my patient, but just it's good to think about medicine in a different way, and interact with people and have a job. It's good for people to work, good for me to work, and then to keep praying that we get this radiotherapy kind of set up. Again, planning scans on Friday, and then probably start a week or so after those things have been planned out. And then, again, just keep praying for her to do well, and she has done very well, and I think she will continue to do well. At least I'll keep hoping that she'll keep doing well. And then you can also just continue to praise God that we have a good family support system up here too, and Britta's mother is staying with us and has been very, very helpful, and I think all the folks around us in our church and family have been, and work too, for that matter, have been very supportive. So I'm grateful for all those things. Count your blessings. Thanks for watching, and I hope you have a great night.